Kia ora, my name is Dasha Kuprienko. I'm a journalist at NZ Business. Today we are here interviewing Dr Michael Chu, who's a full-time private surgeon based in Auckland, specialising in liver and pancreas surgery. Well, Michael, at the start, I wanted to just see what your background is. Can you tell us a bit more about where you studied and trained, and what led you to specialise in what you're specialising in now?
Okay, so I grew up in Malaysia. So I was born in Malaysia. I came to New Zealand when I was about 14 to Christchurch. So I grew up for my high school in Christchurch, and I went to medical school in Dunedin, Otago University. And then I did my clinical years, which is in medical school, you split it into preclinical, which is basic theory studying, and also the clinical years dealing with patients and interacting with them. So I did that part in Christchurch Hospital. And then I moved around the country for my surgical training. So the reason I want to do surgery is, one is I like to fix things, and also the patient interaction and the pathologies and the different things and the patients I can see, a lot more variety as well. And I was inspired mainly by a surgeon that I worked with in Gisborne Hospital when I was a junior doctor. So I inspired to do general surgery. And then as I progressed in my work, I met with a mentor that kind of inspired me to do liver pancreas surgery. So I initially wanted to do transplant surgery, but I still do transplant, but for kidney transplant. So I think from that point of view, I want to give patients a second chance in terms of giving a transplant to them, meaning they get a second chance in life. And I like the liver pancreas surgery because it's technical and it's quite challenging, but also very rewarding with patients get treated at the end.
Yeah, absolutely. And what inspired you to start your own private practice? Because you said that last year you've started your own practice. So how come you did that?
Yeah. So one is a couple of reasons. One is the flexibility of work-life balance. So that gives me, if I give me a private practice, gives me a flexibility of having more time with family. I've got a young daughter who's in primary school, so I thought if I did private practice, it gives me more flexibility to be able to organize my own schedule, to be able to spend more time with her and spend more time with family. And also I suppose the financial aspects of it is you get what you put in, and I think it's more rewarding than the public system. I do still do public system to do kidney transplant in Christchurch as well. So I do like to give back to the community. But for my work in Auckland, I like to be able to spend time with family, really. So that's a big driver for me.
Yeah, that's very fair. And how was that transition for you?
It's a very awkward, because even from medical school and graduating and working in the public system, I've always I've obviously worked under the hospital system. And I think for me to be able to transition to become my own boss and my own employer, that was very challenging. And obviously its own challenges as well. But I think I had good support and mentors, and my wife was supportive as well. I think that really helped me transition to the private practice.
And what are some things that you quickly had to pick up as being your own boss, some things that were challenging at the start?
Yeah. So one is to be able to find a good accountant and to do my own finances, to all balance my own books, and also to be able to work the logistics of working in private, because in public, you've got a network of people supporting you and you just go and do your job, and your job's quite set and predetermined. But in private, you have to be able to organize your own life around it. Like for me, when do I see patients? When is my clinic open? And when do I operate? And how do I book an operating list? That's all part of learning. And that's quite challenging to start with, because when I first started, I have no idea how to do any of the organizational logistics of it. But after a while, with a good personal assistant and secretary, I think that's kind of helped me learn it. But I think the biggest part is the business side of things was the hardest part of running a private practice.
Yeah. And how are you managing it now, like in terms of also getting clients? I believe, in the business, there's always a strategy in place on, how to get the leads. What are you doing as a private practitioner to get there yourself?
So as discussed, probably the way a patient gets to come and see me are three main reasons. One is through a different specialist, so that's they can refer to me, or through their GP, which is the most common, or the other one is the patient comes and find me themselves, what I call self-referrals. So I have to work on strategies for all different aspects. For self-referrals, the main thing I did was to have a website. I had a website before I even started private practice, and also engage pure SEO to be able to help boost my visibility on the Google search, and also advertising as well. So that's for the self-referrals. For the GP referrals, I purposely made time and effort to go and visit GP practices to give talks to them, to engage with them, and also be available to them if they call, and also speak at conferences that are geared towards general practice. And for the collegial referrals, it's just to get to know people around, if go to conferences, network with them and say, hey, I'm around if you need any help. And I think the biggest advice I was given, and I would give to new private surgeons, is always be available, and be available to your colleagues, available to your patients, and be kind to them and be nice to them. That way people will speak about you. Yeah.
Oh, definitely. Being a nice person helps.
Yes. Yes.
Yeah, and I also guess when you have a happy client who gets to be alive and thriving, healthy, then they will refer other people to you as well.
Yes.
So how much time do you say you spend like doing work versus like networking and just doing live?
Yeah, so the main thing like I always said, the work is the easy part. So that's what we train to do, that's what we enjoy to do. And you always have to, for work, for me, you have to enjoy coming to work. You have to find something you enjoy coming to work. For me, operation and seeing patients is what I enjoy. So I do enjoy coming to work. My wife would say a bit too much, and so with my friends. But I think that's what you have to find as a doctor, to be able to be passionate about what you do. If you start losing passion about coming to work, you will have to take time off and find that passion again. Because dealing with patients is difficult in terms of their prognosis, or the patients can get really unwell, and that's very mentally draining and emotionally draining. I think you have to find time to be able to deal with that. For me, I'm a Christian, so I'm a religious person. So I think from that point of view, it helped me in my balance of finding for work. But for a work-life balance, it was very hard until last year, until I said, I do have to purposely make a point of finding time for myself, say, because of being a private surgeon, you're more flexible. I can do 1 day a week or half day a week of during the weekday, saying, this is my time. I'm not going to work. I'm just going to the gym. I'm going to read a book, or I'm going to do something else for that half day. So that's for the weekday. And for weekends, I try not to have anything planned for the weekend, so I can spend time with my family. So I did kind of, I suppose, consciously make an effort and say, this is what I need to do to be able to have a good work-life balance in the long term. Because I've seen a lot of colleagues, they work a lot harder, work 7 days a week, and then they burn out at the end because I don't think they find time for themselves.
What about the point that you made before about of always being available? How does that work with that? Do you just not pick up the phone sometimes on the weekend, or?
Yeah, so if I'm on call, it's hard to say. Like, if always be available for during the week, it's mostly for work related. It's easy. But after hours, patients are actually quite good. They don't call you unless they're really unwell. And for those, it's very rare and very far in between. And I think being available for them means I'm just on the phone call, and for 5-10 minutes, that's easy. But also they're also very good at not calling you on the weekend unless they're really sick. So that's quite good. So I'm not on call as much anymore, which is quite good for work-life balance here.
So you said you're very passionate about, getting up in the morning and getting to work. What do you love the most about what you do?
To be honest, the operating part, the doing things. I like to be able to fix things. So seeing patients, interacting with them is a good, I like chatting with people and getting to know them. And I think just to help people is what I aim to do. And so I'm a typical surgeon that I like to be able to just operate on things. But talking to patients and interacting with them is a very, very important part. But what I do love is the operation, and be able to get in there, do something and to know that I've done something to be able to fix the patient. That's what I really love about my job.
Yeah, beautiful. And what do you find the hardest about, working for yourself as well? What are some things that you had to overcome to to be able to love everything that you do?
So the hardest part being a private surgeon is actually how do you promote yourself or how to advertise. So as training as a doctor, we never learn about how to promote yourself. Also, I suppose it's but what my Asian background, we kind of try not to promote ourselves too much. And I think that's the hardest part as a private surgeon is I have to get out of this mentality and to be able to say, hey, I need to network with people, need to advertise myself. And I think that's the hardest part from the logistics and the work point of view, yeah.
And any qualities that you get from being a surgeon and from your training, which was very thorough, that qualities and skills that you can also apply to being a businessman, anything that's there, I imagine like being so precise at surgeries and being detail-oriented really helps with other things. Would you agree? And what's the link there?
Yes, I think you're right. So the biggest part of what I always trained to do was to be attention to detail. Because what we do in liver pancreas surgery is very, very, I suppose, minute things that we deal with. Little details can go wrong really quickly and can lead to catastrophic outcomes. So the attention to detail, and also I did a PhD, a doctoral, at the University of Auckland, and also that also allows time management. So the two biggest things I could say would be time management, because you have to plan your day, your operating theatre list, and how you go about your day. I think that translates very well to the business side of things, because I try very, very hard not to be late for anything, and especially for patients, because they've spent time coming to see me. I do not want to be able to say, let them wait for half an hour, 45 minutes, because I think that's, one, is disrespectful. I would not like to be treated that way, and I try not to treat my patients that way. And operating wise as well is the attention to detail, is to be able to find what to do in the business side of things. So I'm very fastidious about log booking and also bookkeeping and everything. I think that really, really important, because I hate delaying things and letting them pile up and then suddenly have to do it within 30 days. I think that's just too much to do at once. So I think I have to learn how to do small bits so that it doesn't pile up and put more pressure on myself.
Yeah, totally makes sense. Any tools that made your job and bookkeeping a bit easier? Maybe you can share some tools that you can't sort of live without.
Yes, so the accounting software one is Xero. I think that's very, very, very good. Obviously, that's introduced by the accounting firm, but also Xero is compatible with my patient management software. So that's also very good. So that's very, very important.
What's that other software?
It's called Elixir. So the patient management software. So all my patient details go into a cloud-based software, and I can go anywhere in the world, log into a website, and can find all I need to do about a patient, and I can work from overseas even without my laptop, and to be able to do clinics. I think that's very important, and those two have really changed my practice, I suppose. And my mentor have worked with different softwares. He goes, this is probably the most easiest to use, and the best one he's got so far, the Elixir software. So I think those two are very important. And I think I've always been told by the accountant is to do your reconciliation either once a week, because it piles up at the end of the month. And I think that's very important, because and by then you will forget what you've done for the last month anyway.
Got to stay on top of that.
Yeah. So very, very bookkeeping.
Yeah. And you also mentioned your mentor a couple of times. What's the importance of mentorship for you, and who is your mentor?
Yeah. So my mentor is Adam Bartlett, Associate Professor Adam Bartlett. He's another liver pancreas surgeon. He's the guy that's inspired me to do my research, and also what I do, liver pancreas surgery, and also transplant surgery. And I think for any doctor or any field, I think a mentor is very important, because they've been through what you've been through. They know what are the pitfalls. They know what are the things that can go wrong. and to help you set up. And he's helped me set up private practice. He's helped me set up what I'm doing now and telling me what not to do and what I can do. I think that's very important because they've got so much experience that without a mentor, would be floundering and still learning ropes by myself. But I think with a mentor, it has just speed up by a few years at least, I think, to be able to know what to do and where to go.
Yeah. Oh, that's amazing to have those people by your side then. And I guess in any businesses, setbacks happen. And I kind of would imagine if the transplant surgery goes not good, that's a setback.
Yes.
But in terms of a business side of things, can you share a moment where things didn't quite go as planned? And how did you navigate that?
I mean, I've been lucky so far. I think it's a bit hard to say. Because from this field, obviously it's different to a lot of other businesses in terms of setbacks. I suppose for me, it would be downtime. So downtime for me means I've got no income coming in. So that's a bit hard. So I think I suppose not the biggest setback, but it's a setback is taking time off for holidays. It's a setback for income and also for the business because if I'm not working, I don't have any income. So that's something I have to work on in terms of doing that. And I think I've been talking to colleagues about investing in other businesses so that even when I'm not working, I've still got income being generated. I think that's something to work on. And for me as a sole trader is that it's hard to get businesses coming in and patient referrals. So I think that's the biggest part of trying to navigate how to go about when there's a dip in work, how to go navigate that. So what do I go to kind of minimize that, I suppose,
Truly. And is your work sort of seasonal then, or it's unpredictable?
It's unpredictable, but it is busy mostly in November, December before Christmas. But January is generally the low period. But it is very unpredictable in terms of, I suppose it's hard to predict when people get sick.
Yeah. And what would you, if you were to invest, would it be something to do with medical or completely irrelevant?
Yeah, so I'm interested in investing in like a hospital or medical practice where we build a hospital and then we consult there and operate there. I think that's something kind of long term, and that's something I've been thinking about. Yeah.
Oh, cool. So is that your future plans? How do you see your practice moving forward? Dr. Chu clinic or what? So
not quite that way. So will be, if I invest in the hospital, it'll be with a group of people and we just share the facilities. I think that's what it is. And obviously long term, where do I want to practice and how do I practice? It's still about 4 or 5 years away, but I have to think about it. Yeah.
Absolutely. And would you do it in Auckland or?
Would be in Auckland.
Yeah.
It's because that's where houses and my daughter's school is, and it's also a very warm place compared to Christchurch. But I think for me, there's just a lot more things to do and in terms of lifestyle choices here in Auckland. Yeah.
So meanwhile, in that 5 years, what steps will you be taking to set yourself up for that? Do you think you just need to work on what things would you be working on to make that happen?
Yeah. So one is to probably find colleagues. I think they just find good business partners to start with, and also find good advisors on the business side of things, and to continue to grow my practice to be able to achieve that really. And through that will be work hard and work well for patients and continue to care for patients, and also speak to conferences and also to advertising. Yeah.
And any advice you would give to doctors who might be watching this and they're considering making that transition into private practice, what would you recommend they do at the beginning?
So I think finding a senior colleague and mentor is really good. Just have a real discussion with them and just find a few people, not just in the specialty you're doing, at different specialties, and say, how do you practice and how do you go about your practice? And obviously finding a good mentor is very important, but finding different people to talk to, and asking your friends who's been into private practice as well. So I think that's very important. And for me, obviously, is my mentor, but there's also groups of practices around the city.
Okay.
So if you say orthopedic group or ENT group, if you go into a group, they're very supportive and they're very help you set up. But yeah, I think the main thing is to speak to lots of people about how to set up and learn about business side of things. Speak to an accountant, speak to a lawyer, and that's very important.
Yeah. And I want to ask you, what are some of the most memorable things from your work life? Maybe something odd, funny that happened that you, stands out from your time of being a surgeon.
Yeah, so that's a few. Being from a Chinese background, a lot of Chinese patients don't want to have their gallbladder taken out. So it's an organ that stores bile and to help you digest fat. But in the Chinese culture or in an Asian culture, they think removing an organ is a bad thing. And they've had friends and family that's had the surgery. They think they've got side effects or they're worried about cancer in other parts of the body. I remember a patient kind of telling me that she had this procedure done in China where they remove all the gallstones from the gallbladder via the inside internally. They spent about 5-6 hours doing it. And then 2 years later, she came and saw me. She had more stones in there. So my advice to Chinese patients now is that you can have these procedures done, but two things: you will have more stones and you will going back in to operate on you might be a bit more difficult because of the scar tissue formed in the first time. So that's one, is to navigate the cultural aspects, and being from a Chinese background, it's easier to navigate that than I'm sure some of my colleagues.
Do you convince them to do that? Or?
So it's if they've got symptoms, so to talk to them, if they've got symptoms from gallstones, I would strongly recommend that. But at the end of the day, that's all I could do as a doctor, as a recommendation. So if they decide not to have anything done and take the risk of having complications or problems, I can't force people to have surgery.
Yeah. Oh, nice. You have that background, so you can manage that better. Cool. Well, thanks, Michael. That was a great interview. I'm sure our readers and viewers got some insights from that. So I'll talk to you again soon. Thank you.
Thank you,
Thanks,
Dasha.
Michael.
Cheers.
Cheers.